Hello, my name is Maria, and for this week's skill demo, it's on Carrie, a 60-year-old female woman who reported that her life has become profoundly limited as she avoids leaving her home, fears of being in danger, getting robbed, deep-seated mistrusted of others. These fears have increased her social isolation, predicting they also have increased anxiety and distress, leading to heart problems. Further, she reported difficulty sleeping the day before any medical appointment. So, for this diagnose or therapy session, I would say isolation can be both a cause and a symptom of anxiety. If a person is experiencing anxiety, she may, or our client in this case, may be less likely to engage in social activities or socially with the world around them, and begin to be isolated. Because due to her anxiety, they may feel like social interactions can be too overwhelming for them. They choose to avoid them altogether. Coping strategies can be offered during the therapy sessions to help ease the tension, trying different grounding techniques and breathing relaxation techniques to manage anxiety symptoms. Take a social situation that would normally make you feel like anxious and make a plan on how to make it more manageable. So we could work on different strategies with the patients, different plans to get her away from feeling like anxious or endangered, just so her nerve system could go down and relax. Work on building resiliency and self-esteem to help combat negative thoughts and negative self-beliefs. Another way to improve social isolation is by finding an activity that the client or the patient, in our case, will enjoy, like restarting an old hobby or taking classes to learn something new. I will also provide solution-focused therapy and CBT therapy. For solution-focused therapy, solution-focused therapy views the client as the expert in solving their own problems. So, as their therapist or social worker, I will help the client identify their strengths and resources so the client could clarify their goals and find their solution to their problems. For CBT, with isolation, our client is avoiding social events because she has anxiety, so she feels social isolated. So we'll ask our client to join like a CBT for anxiety group, so she could come out of her shell. The more that our client gets used to being alone, is the more stressful social situations become. So exposure therapy techniques and other CBT tools can help guide our client towards living a life free of desire to be alone. In CBT, the therapist or me, the social worker, will help the client like process a treatment plan to work together to help develop strategies to overcome her anxiety and establish new skills. These skills will help our client continue to address their condition on their own. One smart goal that they might have will be to improve their confidence in the social settings. Another smart goal she could have is going to the anxiety group session once a week for the next 5 weeks. A third SMART goal could be if the client still has symptoms of anxiety, practicing different coping strategies to help calm her stress down. Thank you.